These beaches on the Spanish island of Ibiza are usually fit to bursting with sun-seekers from all over Europe. But this year, there are just a handful of visitors to these golden sands, bar terraces, and shops. The pandemic has hit the island hard. Like many other places across the globe, the people of Ibiza need the income from summer holiday makers to make it through the year.
When things were going well during high season, we had 14, 15, 16 workers. Recently we had 5, and I'm not sure how many will remain, but right now we are 2.
The UN World Tourism Organization estimates that this year could see earnings from international tourism collapse by 80%. And as many as 120 million jobs could be lost. Can the tourism sector ever recover? Welcome to DW's COVID-19 special. I'm Janelle Dumala, and thank you for joining us. We all feel like we need a break from the coronavirus, but going on vacation during a pandemic is far from straightforward. That is, if it's even possible. Is it okay to jet off with a family? And where do you go? The rules are changing quickly, depending on what you decide. In the past few days, the French city of Nice has made face masks compulsory in public areas.
The tourists are back on the beaches of Nice. They mostly come from France and European Union countries where coronavirus lockdown restrictions have been eased.
200 minimum.
Lufthansa flight 1059 is just arriving from Nice, landing at Frankfurt Airport. The aircraft will make a brief stop there before returning to the Côte d'Azur. The first holiday makers are already at the gate, but boarding takes longer than usual at the moment.
I kindly ask you again to remove to your seat and wait until you roll called. Thank you.
Normally, passengers who've just landed can disembark within 5 minutes. But because of measures to contain coronavirus, it can now take half an hour. If you're looking to catch a connecting flight, you have to factor in more time. That's because we need to observe social distancing rules. Some countries also have rules that require people to disembark by row to ensure that everyone doesn't rush to the exit at the same time. The pandemic also means other changes for those travelling to holiday destinations. Face masks are mandatory in many public places, including airports. If necessary, passengers can pick one up at a dispensing machine. Social distancing must be observed in places like the check-in lines, and there are machines for disinfecting hands. Travellers should be familiar with coronavirus rules for their destination.
Before
you book, it's important to clarify any entry requirements. They can change at very short notice, so you need to be prepared. Many countries, for example, require you to register on arrival. Some countries, such as Thailand, require passengers to submit a current COVID-19 test. These tests can be carried out shortly before the flight, like here at Frankfurt Airport.
We take a throat swab here and then pass it on to the lab. Within 6 to 8 hours, you then get an email saying your results are ready.
The Lufthansa flight is on its way back to Nice. Face masks are compulsory on board for everyone, that is, apart from the pilots. The crew have to field a lot of questions during the pandemic. After all, in an aircraft, there are typically around 200 people sitting together in an enclosed space.
One major concern is the circulation of air in the aircraft. Is there a greater risk of infection? This air is clean because it's filtered and heated to a very high level, similar to the air in surgical operating theatres. So it's very clean.
The 1.5-hour flight time passes swiftly. Passengers are kept busy. The pandemic means a lot of forms to fill out, even when travelling within Europe. Passengers have to fill out 3 forms each, which all have to be distributed. That takes up a lot of the time we used to spend looking after everyone. These days, the focus is health. The Mediterranean coast is not far away now. The view makes the extra effort worthwhile. time for a great holiday.
I'm joined now by Mohammad Reza Farzanegan. He's an economics professor at the Philipps University Marburg here in Germany. Professor, you've done a study that shows a relationship between international tourism and the coronavirus outbreak. Could you tell us how tourism is impacted by the spread of COVID-19? Were you able to track that spread or identify hotspots?
Well, tourism industry is based on human-to-human interaction, so it is not surprising to think about the relative importance of this business and this industry in outbreak of COVID-19. However, what we did in our study was to look at the other factors which are able to explain cross-country variation in the COVID-19 cases and deaths. We show in our study that 1% countries with a 1% higher level of international outbound and inbound tourism are experiencing 1.2% and 1.4% higher level of COVID-19 cases and deaths. So basically, this is an empirical evidence which shows the role of globalization, the role of tourism on expansion of the COVID-19 outbreak and virus. Basically, because of the nature of tourism is relying on human interactions and the mobility of the people.
Saying that, however, what about countries whose economies are strongly dependent on tourism? They can't really replace their revenue sources overnight. What can they do?
While high-income countries, the OECD countries, are receiving many more number of the visitor as the most popular destination for tourists, but here we do see a significant higher level of dependency of the economies of developing countries to tourism. So that means there is a higher risk of vulnerability of the developing countries regarding the COVID-19 negative shocks. And these countries, basically, in the short term, they don't have that much option. They are very much reliant on the international assistance, the emergency aid and foreign development assistance. Because otherwise they might face significant political risk and instability, and the cost would increase even more, not only for them, but also for global community. In the long term, of course, these countries need to diversify their economies, shift from tourism partly to other sectors, such as manufacturing and agriculture. Also, they need to implement some institutional reforms and establish tourism establishment fund, which help these countries to deposit part of their unexpected revenues from the tourism and spend it in the daily, in the time that they need it, especially, for example, under the COVID-19.
And finally, how does the tourism industry itself need to change in order to survive and keep people safe at the same time?
The information technology and digitalization will not only reduce the business cost of the tourism industry and increase the efficiency and productivity, but also may offer new opportunities for these companies. For example, nowadays we hear often the story of virtual tourism. So virtual tourism might be an option under the COVID-19 or similar cases in future that the companies can focus on that. Also, it might be more feasible or even recommended to focus on the domestic destination rather than international destination. It's easier also to control the health issues and monitor the public health maybe at the domestic destination compared to international destinations. And of course, here we need also type of institutional reform that I just mentioned. The Tourism Stabilization Fund in the countries which the economies are very much dependent on the tourism might be a necessary institutional reform that these countries need to think about and plan for that. And the government also needs to help these companies, the tourism industry in the private sector, by financing the investment in capacity development, in infrastructure, to improve the health infrastructure, to regain the confidence and trust of the customers to this business in order to survive this process and also protect the safety of the customers.
Professor Mohammad Reza Farzanegan, economics professor at the Philipps University Marburg, thanks very much for your analysis.
Thank you.
And now it's time for your questions. Here's our science correspondent, Derek Williams.
For how many days are asymptomatic people contagious?
This is one of the questions that medical professionals would love an answer to, but it's pretty complex, and we haven't even nailed down answers to simpler related questions like what percentage of people who get the disease can even be classified as asymptomatic or how infectious they are. You might remember last month there was an uproar when a WHO official appeared to say that there were indications that asymptomatic people very rarely passed on the disease to others. That was followed by a lot of backtracking. But maybe it helps to look at what we do know. One expert I read on this said that transmission from people with symptoms generally tails off completely within 8 days after the onset of those symptoms. And he thought it unlikely that an asymptomatic person would be infectious for longer than that. That sounds plausible to me, but it doesn't constitute proof.
And before we let you go, here's a story about New Zealand honeymooners who have been stranded on the remote Falkland Islands because of the coronavirus. They finally managed to return home 5 months later. Fiona Clifton and her husband Neville hitched a lift of more than 9,200 kilometers on an Antarctic fishing boat. The couple arrived on the remote islands on March 7th as the pandemic began to worsen. Now, after a month-long journey through some of the world's most perilous seas, the pair are finally back in New Zealand.